down, you need to ensure that you've got all your drugs and pumps and infusions drawn up as per the SOP. So you need 2 sets of drugs or infusions that the patient is on, because one set will be run from the control room through the holes in the wall, which we'll show you later in the video, through to the patient, and will be under the control of the clean doctor. And then the original set will be used to bring the patient down. Obviously you need to confirm with MRI that the patient is safe to go through the MRI scanner, and they'll complete the safety questionnaire prior to coming down. You need to bring all of your drugs and equipment, because you can't rely on picking anything up down here that you need. So all resuscitation drugs, all equipment you think you might need for the transfer, you need to be self-sufficient. So here we are on the ground floor. We're just by C block lifts here, but you'll come down this corridor from the B block lifts down towards the MRI scanner, which is this way. So we just come down this corridor. Bear in mind, as usual, plenty of obstacles to avoid, and the door in is actually very tight. So we come through here, and then come through these double doors. And after this point, it's access controlled, and if you haven't got it on your badge, then the porters should be able to let you in, or the MRI staff. And then through these doors we come into the MRI atrium. So this is the MRI atrium. So this is where you'll come to with the patient initially. Through that door there is the MRI scanner. Behind that door there is the MRI control room, and through there is the anaesthetic room. This is the entrance door you'll have just come through. That door to the MRI control room has to remain closed at all times with a red, amber or purple patient out here. Some of the MRI staff should be at home shielding, but have elected to come to work, and we have to respect their safety and not open that door, please. So once you've brought the patient in here, you'll then move through to the anaesthetic room, which is in here. So once you bring the patient in here into the anaesthetic room, this trolley won't be in here, but the radiographers will bring the table, which is attached to the MRI scanner, from the MRI scanner into here, and the patient will be transferred onto the MRI table in here. You'll also attach the MRI compatible monitoring.
Okay, so this is the patient monitoring we're going to be used. This is the standby on and off button. Just put that on, it'll start up. So it just takes a little while to start up. Okay, so the default mode is pulse ox on here, so you just need to change that mode into adult ICU mode here, and then confirm yes. Then you'll be allowed to use your pressure leads here, which you need to plug into your transducer. You've got CO2, you've got non-invasive blood pressure, which we don't tend to use very much. And then at the back here are the wireless ECG, which are battery operated. So you need to make sure the batteries are fully charged. The charging point is over there. And the radiographers normally change them in between cases, so make sure they're fully charged. So that's your ECG, and then you also have pulse ox. And then there's 2 different adult clips, and then there's one label P, which is for pediatric. Generally you need the adult clip for ICU patients. Connect those to the patient. You need to make sure that you put on suitable electrodes there, which are these, which they are obviously MRI conditional, and you need to take off the metal clip ones from ITU.
So communication whilst you're down here between the dirty team and the clean team. So there'll be one clean doctor or ACCP in the control room, and then there'll be a dirty doctor and critical care nurse responsible for the patient, who won't be in the MRI scanner. They'll be waiting in here in the anaesthetic room whilst the clean doctor monitors the patient in the MRI control room. So to communicate, we've got walkie-talkies. Turn it on with this knob on the top, just clicks, and then the volume goes up. To call the other walkie-talkie, you press this button, and then to answer the call, side, and to talk, you hold the button on the side down. Obviously you need to ensure they're both on the same frequency, in this case set to 5, and that you can control with these up and down arrows, but at the moment it's locked. MRI control room, some lovely MRI staff working in it. This is the monitor that will connect to the MR compatible monitoring automatically. Obviously you need to turn it on. And then these are what we refer to as a waveguides, that hold in the wall to feed the infusion lines through. So the Queen doctor will sit here with the monitor and the pumps fed through these holes in the wall to the patient, and control the sedation and potentially vasopressors the patient requires during the scan. So this is the MRI scanner room. This is the anaesthetic machine. What's really important in here is that the anaesthetic machine doesn't go inside this grey circle on the floor, because it's attracted to the magnet once it's inside there and starts to move towards the patient. The other thing to bear in mind when you're putting a patient on the table is the cage over their head. So if they've got an ET tube in, then you'll need to bear that in mind when positioning the patient, but the radiographers will help you with that. I'll bring the anaesthetic machine over for a closer look. Break here at the front. Okay, so this is your anaesthetic machine. Before you come down, either an ITU tech or one of the ADPs from theatre should have come down and checked it. But just a quick run through of the controls. So this is the on switch. Machine will then perform self-test. This is the control module. And as it's quite an old style machine, you've got traditional flow meters to control your gases for air, oxygen and nitrous oxide. So if I turn some gas flow on, it's defaulted to a volume control mode, because that's the last mode that it was in. To change the settings, you just press these buttons to select. So change the volume, change the rate, change the peak if you want to. And then to change the mode, press this button here, which brings up the menu. And you've got a ventilation mode, and you've got SIMV, PSV Pro, pressure control or volume control. For most ITU patients we would use SIMV. Just to note, if you do change the mode to say volume control, you need to confirm the volume before it will start. Once you've set up your settings on there, to engage the ventilator you switch this green switch that way and it starts to ventilate. So once you're happy with your ventilator settings and you're ready to switch the patient to this ventilator, you bring the anaesthetic circuit out of the room to this area here, outside the MRI control room and outside the anaesthetic room. Connect the patient onto this circuit, disconnecting them from the transport vent. Obviously, taking care to clamp the tube and turn the ventilator so it's off before disconnecting. And then when you're taking the patient out of the MRI scanner to transfer them back onto the transport vent, you do the opposite. So bring them out on this anaesthetic machine on the long circuit. So you'd have a longer circuit than this. This is a standard circuit, and then clamp the tube, turn the vent off, and transfer them over to the other ventilator. So this is the recovery room. This is where all the defibrillator and the resuscitation trolley is kept. So adult resuscitation trolley here with the dissolved defib on it. So just to be aware, if the worst happens and you need to use it, this is where to find it in an emergency.